Periodontal diseases is a serious issue as it can lead to the um, exfoliation of teeth without any damage. Periodontal disease is a gradual disease that takes some time to develop fully and to actually lead to the fact that the teeth will remove and go. So in this video, I'm going to be taking you through the periodontal diseases, some of the periodontal diseases and their treatment. If this is your first time on my YouTube channel, click the red button to your right. Remember to subscribe and leave a comment. Tell me any question, ask any question or anything in the comment section.
Periodontal disease is an infection of the teeth, gums, and the bone that surrounds the teeth, and it's the leading cause of adult tooth loss. Stopping this condition begins with a thorough diagnosis. The main cause of periodontal disease is the accumulation of plaque, the sticky film of food and bacteria that forms constantly on your teeth.
Okay, now plaque is when you look into the mirror and you see any yellow band or anything that is not your teeth per se that is attached to the teeth, that is called plaque. And it eventually becomes calculus, that eventually becomes calcified and becomes strong, that you won't be able to remove it with your toothbrush. When it's still at the plaque stage, toothbrush can remove it, but when it becomes calculus, toothbrush cannot remove it. If you run your tongue against your teeth or use your finger against your teeth and there's something you can scrape off your teeth, that is called plaque and calculus. So periodontal disease is caused primarily by plaque and calculus containing bacteria and affecting the teeth.
It's hard to see plaque, but look at how it shows up after we've stained it with red dye. The bacteria in plaque invade the spaces between the teeth and gums and begin producing toxins. These toxins, combined with your body's reaction to them, destroys the bone around your teeth. Once bone has been lost, it never grows back on its own. When too much bone is lost, there is so little support for the teeth, they get loose and have to be removed. If you have periodontal disease, you may have some of these symptoms: persistent bad breath, bleeding of the gums when brushing or flossing, soft, swollen, or tender gums, gums pulling away from the teeth, and loose teeth.
Okay, so the first one noticeable is usually bleeding gums. Now, most of you or most of the people watching me now may notice that while they are brushing, their gum bleeds. So they feel is the toothbrush. Well, yes, it's the toothbrush, but these gums are already inflamed because there is an irritation. There's something causing them to not be at ease. So there's blood pump to these areas, making the blood easily poked and easily gushing out. So bleeding gums is usually the first one, though. Bad breath comes when these diseases are already well developed. Then swollen gums, that's the same thing. Then gum pulling away from teeth. Now the gum against the teeth should be knife edge, but when there is a periodontal disease, it makes the gum pull away from the teeth. You can feel the distance between the gum and the teeth. Then the teeth becomes loose. That is over time.
These are healthy gums. They're tight against the teeth. There aren't any pockets, and they don't bleed. Now notice the difference with early periodontal disease and moderate periodontal disease. You can see the red and swollen infection of the gums. Look especially close at the inflammation of the gums between the teeth. This is where periodontal disease usually starts.
Well, first of all, periodontal means around. Peri is around, then dontal is the teeth, the term for teeth. So periodontal disease is diseases surrounding the tissues, diseases of the tissue surrounding the teeth, and this can be caused basically by plaque and calculus, which result from food that we take in, different types of food that we take in.
It's also possible to have no noticeable symptoms. In fact, most people who have periodontal disease aren't even aware of it. Because of this, we perform a thorough examination with a periodontal probe and x-rays. Periodontal probing measures the depth of the pockets in your gums. We measure the pocket from the bottom of the pocket, where it's attached to the tooth, to to the top of the gums. A probe reading of more than 3 millimeters is a sign of periodontal disease.
Okay, now there's supposed to be actually a depth between the gum and where it's attached to the teeth. Now, as you can see in this video, the gum goes all the way down, yeah? But when there is a periodontal disease, this gum, the space between it and the teeth, the depth goes all the way down. At the brink of this, where this probe is attached, the gum is attached to the teeth at that point through fibers. Now, the fibers will be destroyed, and there will be an opening. So when you put your probe, it will go all the way down. This is a sign of periodontal disease. Now, the normal length of this depth is supposed to be 2 to 3 millimeters. Now, if it's up to 4 millimeters, then there's a problem.
In general, the deeper the pockets, the greater the spread of periodontal disease. Gums sometimes bleed during probing. This is also a sign of infection. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are, compared with the healthy mouth, and notice the tartar on the teeth. Tartar shows up on this X-ray as small white lumps on the sides of the teeth. Once we've found periodontal disease, we'll talk with you about treatment options and proper home care to minimize bone loss and restore the health of your gums.
Okay, thank you for watching. Um, Remember to subscribe to my YouTube channel and click the red button.